Hi, everyone. Thank you for joining us again on Let's Talk. Today we have a doctor. A doctor is in the house. Yes, a doctor, a friend of mine. We've been pretty much my sister from another mother. She is an OB GYN. She also is a business and entrepreneur. She has three kids, husband. She's in her 40s. She is doing it all with such grace, elegance, and it's such a great time to have her to talk about it. Like, we're in our 40s. What do we need to know? What we should be aware of? What is it? How do we feel being in our 40s? What do you think? Like,
I think you just outed me for being in my 40s, but totally cool, you guys. I'm like super proud of it. Yeah, with age comes wisdom, and this session alone is going to give me some wisdom on what the
I
going
know
on.
it's definitely going to give us some wisdom. So, you guys, it's going to be an interesting topic, and I know it's going to be educational for sure because she's all about teaching as well. So, be sure to check us out after the conversation, and we'll tell you our final thoughts. Talk to you soon. Bye.
On this episode of Let's Talk, the AfroStyle Podcast, we sit down with Dr. Nneka Okezie Okeh, a board-certified OB/GYN, educator, and women's health advocate with over 10 years of experience. She brings wisdom and practical insight into what it really means to flourish in your 40s navigating health, identity, purpose, and self-discovery in this exciting chapter of life. Enjoy the show.
Hey, sunshine.
Hey. Hi. Hi,
How are you
ladies.
doing, Mama?
I'm doing great. I thank God. God is good. How are you all
the
doing?
time. Good. Thank you. This is my partner in crime, Camellia.
Hi, Camellia. I've heard so much wonderful things about you.
And she has as well. She's the one with the three kids.
Oh my God, how do you do it? How do you do?
I don't know how you all do it, but it is something to behold. I have to say, I'm just like, wow, you guys, the things that you guys make motherhood. It's tough, but you guys make motherhood. I think it shows how strong you both are because you guys have that patience. And I said to myself sometimes, I don't know if I would have the patience, but still.
You would do a lot of yelling, but you would be the best mom.
Oh, I can see that. I can see that.
I
thought she would be the best.
Yeah, she's a sweetheart. I wouldn't even have any problems with you. It's like it's hard for you to be mean, so you would be a natural.
Oh, well,
Yeah.
I'll let you guys know when I cross that one at this
We'll
point.
be there.
Amen. So, you're the perfect person that we have to have this conversation with.
Okay.
We are no longer the young tenders that we used to be.
No, everything is a mind. Age is nothing but a number, but we're not going to go there.
Yeah, but sometimes it's just like, you know what? When we were in our 20s, when I think about it, we are all in our 40s now. And so when I think about it and I look back, and it's almost like, man, time has gone by so fast. And I tend to wonder, like, have I missed out on a lot of things? The only thing missing is I ain't got a man, or kids, but there's a lot of things that have gone on in our lives that, now that we're in our 40s, I kind of feel like now in my 40s, and you let ladies know what you think. I tend to, like, from time to time, just sit back and reflect about how time has flown, right? How does it feel for you ladies being in your 40s now? Like, what goes through your mind? How do you feel?
So for me, 40s has been an amazing decade so far. I feel when you're in your 40s, you're more sure of yourself. You know what you want to tolerate and not tolerate. And also, it's been a time of wisdom. I feel like I'm more wise in my dealings in different situations. So it's been great so far.
When you compare that to your 20s and 30s.
Well, our 20s were amazing.
I don't even know why I'm putting the 20s in there, but I'm just like, I remember we used to hit the club and all that stuff.
Oh, the 20s were great. I will always forever cherish those times at Howard University and those times in undergrad and grad school. Yeah, those times are different. You're more open to exploration. You're still learning yourself. You're trying to establish your career. And for me, one of the biggest transitions has been just energy wise. I don't have as much energy as I used to in
Mhm.
my 20s. Now that I'm in my 40s, now that could be twofold. It could be the fact that I have three kids now,
That'll
and
do it.
I'm, still working as a physician, or it could just also be changes. We're just getting older. And, as we age, we'll start feeling the effects over time.
How about you? Like, how do you
Yeah,
feel?
sometimes I envy women who had their kids in like their late 20s
Hmm.
because I'm like, that is the energy level I need to be at right now. And I honestly, like, I know you make it look like we're doing a great job with
Hmm.
this mother thing. I don't know how you feel, but I feel like I'm broken in half a lot, like
Um,
physically, mentally, like, and like I always pick myself back up again, but there are definitely days where I just feel brittle.
Hmm.
I'm like, man, my energy, but then I look back at everything I accomplished before 9 a.m. and I'm like, wait a minute,
yeah.
this is a day's worth of work that
Hmm.
I've already done. So it makes sense. Um, it's just like, I guess there's a perception that there was more energy before,
Hmm.
you know?
So when
Yeah.
they say, but how about when they say, oh, the 40 is the new 20? Is that true? Or do you think is that because now people say 40 is the new 20, then they'll say 50 is the new 30. And I'm just like, is it just to make people feel good? Or is this, do you feel this is how
Hmm.
it really feels?
I don't know if it's to make people feel good. I think now, just the way society used to look at women as they age,
Mm-hmm.
it wasn't quote unquote, I guess, sexy to be 40, but
Mm-hmm.
now women have really become more independent. We're, owning our own businesses, we're getting educated, and we're looking good at the same time.
Mm-hmm.
So I think that's more of the 40s the new 20, because I think even if
Wow.
you go back and look at pictures of the so-called 40-year-old maybe back in the 60s does not look the same as the 40-year-old
No,
now.
that is so true.
That's true.
That's so
That's so
true.
true. That's very true.
Yeah.
Okay, well that makes sense. Now, what do you think? What would you say, you ladies, and let me know. What would you say is the misconception you had about being in your 40s when you were younger? That you now that you're in your 40s, you're realizing that is true or that wasn't true. What misconception or ideas did you have?
Unfortunately, like I said, I think we were all influenced by what societal standards of beauty were back then. And
Mm-hmm.
to be beautiful back then was to be young, and to be
Mm-hmm.
vibrant. But um, I feel like I'm at my best self since I've been in my 40s. I'm
Okay.
more confident. I don't have to second guess myself. I'm not looking for any validation from anybody. So I think it's a transformation, but it's up to everybody has to go through get to that point in their lives. But for me, 40 has been the best decade of my life thus far in terms of me really being comfortable in my skin and
Mm.
really, knowing what I want for myself and putting my happiness first.
Mm.
What did it take for you to get to that point? Like what experiences was it
Ooh,
experiences or
it's too many experiences to count. Too many, too many experiences to count. I mean, um, meeting different people, going to school, I think also my profession as a physician, you meet different patients, you meet all walks of life, you share their experiences, and it gives you perspective on a lot of things. And I think having that perspective really shapes your gratitude for whatever you have going on at that moment. Everybody's going to have challenges, but it's all perspective.
mm-hmm.
Yeah.
Oh, okay. So now that in our 40s now, of course, our health becomes the thing that we have to pay more attention to. What would you say what are the vital things that women, especially as Black women, women of color, should we be paying attention to moving forward? At what age and going forward, what should we be paying attention to?
Okay, great question. So, first off, make sure you find yourself a great OBGYN,
Mm-hmm.
obstetrician gynecologist, or a very good family practice doctor that specializes in women's health. That's number one because there are certain screenings that we pay attention to prior to 40, but it becomes even more important as we get into that age range. Why? Number one is cardiovascular disease. Right now, cardiovascular disease is the number one killer for women in the country. It
Wow.
surpasses cancers, HIV, all these other illnesses.
Oh.
But cardiovascular disease is the number one killer, and that encompasses having like a stroke or having a myocardial infarction or heart attack. So that's the number one killer for women. The next thing is you also want to get screened for breast cancer. So making sure you get your mammograms once you turn 40 is the best way to detect and have early detection. Going back to the cardiovascular disease screening, there's basic things that you'll get when you go for your what we call a well woman exam. We recommend every woman to get a well woman exam at least once a year, and oftentimes that will include us doing preventative labs such as screening for high cholesterol. High cholesterol can contribute to plaque formation in the vessels in your brain and the vessels in your heart, which can cause stroke and heart attack. So we usually will screen for that. We'll also screen for diabetes. Diabetes is when it's an autoimmune condition where your body no longer can utilize insulin or your body doesn't produce enough insulin. So uncontrolled diabetes can also increase the risk of cardiovascular disease, um, stroke, and even kidney failure as well.
Thanks for tuning into this episode of Let's Talk, the AfroStyle Podcast with Amaka and Camellia. If you're enjoying the conversation, be sure to subscribe to our podcast on Spotify and YouTube for new episodes and exclusive content. Stay updated on the latest news, insights, and behind-the-scenes peeks by following us on social media or emailing us at info@afrostylemag.com. We're always on the lookout for inspiring guests, fresh perspectives, and exciting collaborations. Reach out and let's connect. We'd love to hear from you. Now back to the show.
And then, of course, in going with the breast cancer, right now, 1 in 8 women in the US, unfortunately, will be diagnosed with breast cancer. So the best way to detect it is through mammograms and also breast self-awareness, where you also do your own breast exam at home to make sure you don't find any abnormal lump or you're not having any pain or drainage from your nipples. If you have any of that, you need to go straight to the doctor because if it's caught early, we can prolong the chance of survival. I have even more too.
Yeah.
There's more, there's
yeah,
more. There's so much,
This is what
there's so much that happens. So many wonderful things, wisdom-wise, happens in our 40s, but also challenging health things since our half.
That's what this is about, because the thing is, we all go through, I think sometimes a lot of us, I like to use the phrase, I won't generalize, but a lot of people, women included, think that we're still in our 20s. We're still, able to get down to the ground and jump and say, I'm good. And then we keep going. And then we start to ignore signs. We start to ignore this. And when I had the situation that I went through, right. I kind of feel maybe it's because, I've hit my 40s that I experienced what I did. To this day, the doctors do not know what caused what I went through. Right. But a part of me feels maybe it's also part of me now being in my 40s. And so now it's like I'm trying to be more attentive to my body in terms of if I notice anything. She knows when she tells me, oh, I'm having this little tingling, I'm like, go to the doctor. Because it's like at this point we're in we just can't take that chance of thinking that we're still in our 20s and 30s possibly. So
is there something that happens like all of a sudden you turn 40 and your body goes click, I'm going to turn off this thing? Like what?
Well, there's lots of things that do happen. You're right. There's definitely something going on, especially on the hormonal side. So in addition to our risk of breast cancer and cardiovascular disease increasing, we also have a higher risk of colon cancer. Before, colon cancer screening used to be at age 50, but because there's been such a huge incidence and increase in colon cancers, the age to now get colon cancer screening is actually has moved down to 45.
No way.
So if you're 45 and higher, you should get some form of colon cancer screening. Gold standard is getting a colonoscopy, which is an endoscopy tube where they take a look in your colon and they look for any polyps, which can sometimes turn into cancer, and they just remove it. So it's actually a very good thing that you should get done, but there's been a huge increase in very, very young individuals, 30s, 20s, getting full-blown colon cancer. So
Mm.
that's one thing. So then, of course, the next thing is menopause. You know,
Yep. Yep.
Maybe, yeah,
menopause,
That's the big one. That's the
perimenopause.
big one.
perimenopause right now? I don't know. Maybe. Go ahead. Yeah. Oh my God.
It is something serious. And, I'm happy that finally is getting a spotlight because before it was written off or we were ignored a lot. But definitely, the transition to menopause does occur in our 40s. So, on average, the average age for menopause, the full transition is 51. But for some women, the process can happen as early as age 40. So, what is menopause? Menopause is not having a period for 12 months consecutively. So, if we're tomorrow's June, if you don't have a period between now and June of 2026, then you can officially call yourself menopausal. But if you have a period, in September, the clock starts over again. But it's a
Oh.
complete cessation of menopause. But what people think that, oh, I'm gonna go into menopause, is this gonna happen? That's gonna be it. No, it's a transition.
Like
And
what
what a lot
happens?
of
Like
us are,
what
Mhm.
happens? Like some of the
Right.
symptoms. Yeah.
So menopause is pretty much it's a decrease in the estrogen or the function of your ovaries that secrete estrogen. Estrogen is one of our major hormones that orchestrates a lot of things, including our menstrual cycle. It can affect the elasticity of our skin, our moods, and everything. So as someone is transitioning into menopause, the level of estrogen significantly decreases. And as the levels decrease, you start having symptoms. One of the most common symptoms women will start experiencing are hot flashes, which falls under the vasomotor symptom kind of uh, column of symptoms that can happen. And hot flashes could be, some people will call it like private summers. It's like you're just sitting there and all of a sudden you have this rush of heat come up, you're fanning yourself and people are looking at you like you're crazy. So that can happen. You'll start having changes in your period. So if your period is usually comes every month, you may start seeing it skip a couple months or maybe short for a couple of days and prolong for like 10 days. You'll definitely see lots of intermenstrual changes in your period. Other things, mood swings. A lot of women that are going through that perimenopausal transition may start reporting more symptoms of depression or anxiety or being
Oh,
more
wow.
snappy. A lot of women will experience problems with sleep. So insomnia will occur. Skin changes. Your skin will start getting more thin. I know Camilla's like,
Why
I
is Nneka just mean to women? It's rich mean
I know we have to go through everything. It's not fair.
to
I'm not even done with the symptoms. We
that.
have hair starts
You're like,
thinning, you start losing hair on your
colonoscopy.
edge.
I gotta think one of
You start getting vaginal dryness. You start getting like excessive weight gain. Abdominal obesity starts increasing. Your bone like density starts thinning out.
No.
And then you start having low libido. You don't even want to you just start losing interest in things. So there's so many things that happen during this time. And then while all that's happening, then your risk of cardiovascular disease starts increasing even more because estrogen has like protective mechanisms against like, heart disease and stroke. So it's a lot.
Oh,
But
wow.
ways to circumvent it is to talk to your provider about it. Talk to your physician, talk to a women's health specialist. They can help, give you different remedies or ways to kind of help you through that transition. But don't stay quiet and suffer in silence because it's real. The symptoms of perimenopause are real.
Thanks for tuning into this episode of Let's Talk, the AfroStyle podcast with Amaka and Camellia. If you're enjoying the conversation, be sure to Subscribe to our podcast on Spotify and YouTube for new episodes and exclusive content. Stay updated on the latest news, insights, and behind the scenes peeks by following us on social media or emailing us at info@afrostylemag.com. We're always on the lookout for inspiring guests, fresh perspectives, and exciting collaborations. Reach out and let's connect. We'd love to hear from you. Now back to the show.
Is there a stigma to this though? I'm not I'm wondering because I mean now we have more accessibility to information, but I'm thinking I wonder if even now women in of our age or tend to maybe feel a little embarrassed or have some kind of because of maybe stigma, not maybe here in America is different, but maybe you have women going through that anyway, that feeling of embarrassment, but also in countries that may not have that kind of accessibility, but there's this cultural mindset, that they would look down on them because they start to think, oh, she's cursed and stuff like that. How did
Right.
that, is there that stigma? Do you feel there's a stigma when it comes to that? And how can we overcome that? How can women overcome that?
Stigma or more of lack of just lack of education about the process. I think a lot of our parents, they just went through the process seamlessly. We
Mm-hmm.
may have thought seamlessly, not knowing that they were suffering. I think even as me as a physician, and I'm a OBGYN, which is our specialty is women's health, a lot of focus was not on how to treat menopause. So now over the last maybe 10 years, there's been a significant increase in people actually addressing it. But I'll tell you right now, you ask a lot of physicians that went through training maybe 20 years ago, ask them what their training was on helping women transition through menopause, they will tell you that it wasn't a lot. So
Oh.
now there's been more education, more research, more conferences trying to address this so that women will have a place to go to get relief, because it can be very debilitating and stressful and cause depression in women that don't really understand what's going on. In terms of stigma, again, it's likely due to just lack of knowledge and awareness. For
Mm-hmm.
some men, it was so funny. I was doing a women's health talk at a church seminar for their
Mm-hmm.
women's meeting, and one of the husbands came up to me and he was like, some of those symptoms you were discussing, I think that's happening in my household. And he was like, thank God, because I thought it was me. So
Uh-huh.
it's just about there's a need to definitely educate, more women on the process and men so that the men will know how to support their partners during this
Mm-hmm.
transition time and not, think that they're the cause of why their wife just yelled at them for for no reason.
Oh Jesus, that is something like I can imagine like, dang, what did I do to this woman?
Right, right.
Oh my God.
Yeah.
So, question, in regards to meeting, how important is getting the right doctor? Because I hear a lot of, the stories where it is hard for Black women, women of color, to be heard when it comes to speaking with doctors. And again,
Right.
a lot of them end up losing their lives or just getting, getting unfortunate circumstances happen due to the lack of doctor care. So, how I don't know if the word how, I know it's important to get the right doctor. What should women, all women, but of course we're speaking for women in our 40s, what should we be looking for when it comes to doctors and caregivers?
Well, you want to look for someone who's going to listen to you, answer your questions.
Mm-hmm.
There's an art of listening to your patients. I've had many patients come to me and they're like, finally, somebody listened to me. They may have gone to other places and they were complaining about something, or they may have felt brushed off, but you want to feel like your doctor is actually listening to you and answering your questions. And if they don't have the answer, they're gonna try their best to get the answer for you. Also, it's good for you to make sure you're going to somebody who's qualified. So you want to go to somebody who has a training in women's health, or has certifications addressing certain issues in women's health. we love social media, but there's lots of social media experts that can, put up a nice platform and speak very eloquently, but yet they have no credentials at all to speak on what they're speaking about. So it's very important that you research the physician, make sure they have a board certification, and also look at, the views and the ratings from other people. If it's a good doctor, likely they're going to have good ratings, Word of mouth too. A lot of specialists are found by word of mouth. Oh, go to him or go to her. She's amazing. So
Mhm.
I would say seek out the credentials, make sure they're board certified. And then also word of mouth, ask around, what do you think about this doctor? And kind of make your decision from there. Studies have shown that, you know, it's always good to go to physicians that look like you because there's a
Mm,
unsaid cultural connection that is there that can help relay certain messages that are more effective. That some studies have shown that. But I think a good attentive doctor could be a great doctor regardless of the color. But there have been studies that shown a better outcome if you go to someone who's within your cultural and ethnic background.
Hmm.
that's
Yeah.
interesting and totally makes sense.
Yeah, it does make sense. But man, I mean, I do have my mammogram scheduled coming up, but I do have this question. How I did call to schedule up my pap smear. Well, when I spoke to the lady, she was like, "Oh, you just took your pap smear, was it 2 years ago? So you're really not due for another unless you just want to see the doctor." So question is, and that's what came to my mind. I was like, well, if I'm telling her I want to do it and she's saying I don't need to do it, I said, okay, if I don't have to, then I'll just wait until it's time. Can Is that something that I can still call in and say I want to do a pap smear, even if it's necessarily not time?
Yes, you absolutely have the right to ask or demand for a service. The complexity of it is how insurance wants to cover it. So
Oh,
sadly, insurance has really changed how medicine is practiced. And our hands are kind of held in terms of what we want to do with our patient.
mm-hmm.
In a perfect world, I would do a PAP on my patients every year. Why? Because the patients that I've served are high risk and they have a higher rate of developing cervical cancer within a year,
Oh, okay.
versus waiting the recommended 1 to 3 years, depending on your
Mm-hmm.
situation. So I would say if you want a pap smear, you had one 2 years ago, but you want one, I would just say I still want it. And then the only issue will be that you may have to pay for it out of pocket. Your insurance may not cover it. But those
Oh,
are just based on recent guidelines. Maybe 20 years ago, every year you needed to get a PAP, and based on what the PAP smear showed, you would maybe do another repeat in 6 months to a year. But things have changed over the year with more technology and also testing and screening for HPV, human papillomavirus,
mm-hmm.
that has been affiliated with causing genital warts and cervical cancer. So
Mm-hmm.
now, over the past couple of decades, when you do get your pap smear and we kind of brush off the cervix, we're not only brushing off the cells for analysis to see if there's any precancerous changes, we're also testing those cells to see if they have the virus called human papillomavirus or HPV, which, depending on the strain, can increase your risk for cervical cancer. So based on that, likely your pap smear was probably normal and likely you were negative for HPV. So because
Mm-hmm.
of that, you can go maybe 3 years without a pap. But it
Oh,
all depends. For me, I always look at my patient individually. If my patient is out, she's on the streets, I'm papping you again. I'm not waiting 3 years because if you're on the streets,
come on back. We got to do
there's
this
a
again.
chance that you have acquired HPV because HPV is very easy to get.
Mm-hmm.
95% of individuals who have ever had sex in their lives have been exposed to HPV.
Mm,
Condoms don't protect from it. It's just a skin to skin
Oh,
rubbing. So it's very easy to get. So it all depends on your patient population.
mm-hmm.
So, and that's what I do. I individualize my therapy. Guidelines are there, they're to be followed, but you also have to use your judgment based on which patient you're dealing with. So if my patients are still in the streets, which is fine, no judgment here, you're getting a PAP because likely you have HPV, and I need to know which
Mm-hmm.
strand you have, and I need to follow you to make sure you don't develop any precancerous changes. So
mm,
I would say if you want another pap smear, ask for it and just know that you may have to pay an extra fee outside if insurance deems that, they didn't think you needed one.
Yeah, she kind of made a point like, well, you can come in, but you'd have to pay for it. So I was just like, well, if you think if I'm not supposed to have it, then fine, I'll wait till I get a notice from you guys. So I called it a day, but then scheduled my mammogram. So, man, I mean, there
I
is
would
a
still advocate, Amaka,
yeah,
because I'll
yeah.
tell you another thing. I had a good friend of mine. She was in her mid 30s and we had lost touch, but then we caught up again. And she told me that she had gone for her wellness visit. She was like maybe 35. She went for her wellness visit and she said, "You know what? I want a mammogram." And the doctor was like, "Why?" She was like, "I don't know. I just want one." She's like, "Are you having any symptoms?" No. She's like, "I just want one." She's like, "Well, you don't really get mammograms until age 40," which is true. And I would have agreed with her. But she was like, "I just want one." So then the doctor just obliged her and got one. Stage 2 breast cancer.
Wow.
Yeah.
Stage 2 breast
Jeez.
cancer, no family history of breast cancer,
No
stage 2
way.
breast cancer, 35. So if you're having an unction, you feel you want to get screened, I say go with that
Okay.
and just get it.
Okay.
Mm.
Get the fee and just get it. But for most sites, we'll just follow those guidelines because we don't want our patients to be billed unnecessarily. But again, we can always make a case for needing a pap smear on that visit. So it's really a case by case basis. But I err on the side of caution because I've taken care of a lot of patients that are high risk. So
Mhm.
I err on the side of caution. So I'm more conservative and I go for it yearly.
Yeah.
I feel like stress is the biggest killer,
Stress is the biggest
right?
killer in everything.
Because
Yeah.
I mean,
Stress.
like I just saw this story on the news the other day. It was this 100-year-old like Asian lady who bowls every week, and they show the video of her. I'm like, she does not seem 100. Like in my brain, 100 is like I'm barely leaving couch. She's
Yeah.
bowling, she's golfing. I'm like, this bitch knows something.
She knows
Right.
something that we don't. But I mean, yeah, I mean, there's one other lady. There's one story that came out. I think she was 93 or 94. She's kicking arse like in the gym. She
Wow.
was doing like workouts, and
I
then
want to be
she's
like
known
that.
for her three,
I wanna
four
be like
minute
that.
plank. I'm like
Mm.
2 minutes in on plank, and I'm ready to like cry.
No.
I'm pressing
Girl,
my
am I
coach and
even
everything.
5 seconds? Nothing has changed from that time in 2004 when you and Boma tried to kill me in the gym. But anyway,
You know, yeah, we didn't play at the gym though. I
I
mean, I
believe
still
that.
go to the gym and stuff, but I
Mhm.
remember like she was looking at us like, "This is what you guys do."
I was like, y'all, you and Boma, and then you guys would have a handful of almonds you would eat after your
Yeah,
workout. I'm like, y'all, I'm
Damn.
just trying to
Damn.
do elliptical machine.
I
Y'all are
I
doing
told her
too
I was
much.
like, "Girl, yeah." So you remember Janet Jackson in the early 2000s, like pow 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 pow. She was like, "Yeah," I was like, "That was me. That was me." That was me. So I was
You have
like,
good discipline. Like, she has mad discipline.
but
Oh, I could see you having the whole Janet Jackson.
I was just,
I'm
I
not
think
telling
the
about
other
it.
thing about it is that I never really paid attention to my body like that. It was just like, I like to work out. Yeah, I want to fit my
Yeah.
clothes and everything. It was when one day I forgot my shirt. I was going into the gym and I forgot my shirt. I only had my workout bra. And so I was like, well, I'm not going to drive home to get it. Let me just go. And the moment I walked in, the guy at the front was like, damn. And I was looking at him like, what's his problem? And so it was when I was walking past the mirror and I turned to look and I saw like, I was like, oh, okay. I was just like, snap, snap. I was like,
I love that.
oh, that's what he was talking about. I don't have that anymore, but like you said, in our 40s, things will change. And I had to accept the fact I'm not going to eat.
Why does it all have to go? The metabolism, the collagen, like the estrogen, like no, stay.
Like, I just don't
Do
get
I need
it.
stem cells? What do I need?
I'm
You know?
telling you.
Does stem cells work? Do they work?
But I guess we just have to.
I should have eaten my placenta. That's where I went wrong.
Uh-oh. Who knows at this point, anything. But lots of I think sadly, as you all know, so many things aren't even real. Maybe it's better in California, but just try to eat as healthy as possible. Try to stay away from processed foods. All the processed foods cause inflammation. Stress it's a constant state of inflammation. It's a constant release of cortisol. So that's not healthy. That increases our lipid and plaque formation. So exercise, positive thoughts, see a therapist as needed, or
Mm-hmm.
have a confidant that you can talk to and vent to, because pent up stress is not helpful.
Yeah.
Fruits, vegetables, less carbs, more protein, lean protein. Eat, pray, sleep.
Mm-hmm.
Leave the rest to God, and then if needed, you get on some hormones.
Mm-hmm.
Mm.
Well, now that you speak on,
Mm.
you speak, might as well address it real quick. How important? Because you mentioned having friends and everything. I don't have that many friends. You know, I can only count a handful, and I don't think it's up to five. Are one that I see that you are surrounded by a lot of friends, but not just friends. You have good friends that love you, that love her family, loves her, and she loves back.
That's
So
what's up.
how important are friends at this time in our lives?
Oh, I think it's huge. I think family is huge. I think having friends that have your same morals, is huge. My sister would always say, "Oh, Nneka, I just love all your friends." I was like, "I love them too. I'm just grateful and blessed to have all of them, because
Yeah.
everyone brings just a wonderful, just adds to my life. So you want to surround yourself with people that are going to add to your life and not take away take away
Especially
from
at this time of our lives.
at this time in our life. And also for me, it's my faith, my Christian faith. That's key. Like I can't do anything without the grace. It's all the grace of God. So definitely, in addition to my family and close friends, it's my church family. They're there to encourage me in times of, challenging times. And you can share some things with them, and you know that, only they will know. It's not going to go elsewhere. So I think definitely if you're struggling with anything, talk. Nobody's perfect. You'll be surprised at what this well put together person is going through. You just have no idea what people are going through. So always be available to be a helping hand, a listening hand to other people,
Mhm.
and pray and have a positive attitude. That's all you can, that's my motto.
Yes, ma'am.
Thanks for tuning into this episode of Let's Talk, the AfroStyle podcast with Amaka and Camellia. If you're enjoying the conversation, be sure to subscribe to our podcast on Spotify and YouTube for new episodes and exclusive content. Stay updated on the latest news, insights, and behind-the-scenes peeks by following us on social media or emailing us at info@afrostylemag.com. We're always on the lookout for inspiring guests, fresh perspectives, and exciting collaborations. Reach out and let's connect. We'd love to hear from you. Now back to the show.
Well, last part question I would have is, what do you ladies look forward to for the rest of your 40s? What are you, as you head into, we've gone to the mountain, now we're coming back down from the 40s, get into the 50s. What are you most looking forward to?
Camille, what are you looking forward to? I would love to hear what you're looking forward to.
I don't like to think of it as a mountain.
I mean, whatever way, that was just my description, but
no, I'm still kind of settling into my 40s. Like, I think that there's a lot of gold to be found here. Every decade is just something new, and you just don't know till you go through it. But I think 40 is kind of cool. I don't have that many F's to give, if you know what I'm saying. In my 40s, I have even less, especially after becoming a mom. I just want to see my daughter healthy, happy, and I feel like I'm finding a new level of gratitude. So I'm just waiting for that to keep blossoming.
That's a beautiful one. Nneka, how are you?
I want to lose some weight.
Mm-hmm.
This perimenopause is kicking my behind, so I want to get back into my exercise regimen.
Nice.
Camilla, um, Amaka can share this story when she almost killed me at the gym because
I believe
she
it.
was like a mini Jane Fonda, and her and one of my
I
really good
believe it.
friends, they were just working out. I'm like, what are you guys? It was very entertaining to see. But I want to get more healthy. I want to optimize my health as much as possible in my 40s. So that's one of my goals. And of course, keep raising my kids for them to be, wonderful, stewards of the society.
And this girl, I already told her, like when I'm on the phone with you, we're talking, and be like, Amaka, 1 second. Get down. I said, get down. Why did you open that? I'm like, I'm so sorry. Okay.
Oh yes,
And she'll come
Amaka
back. I'm
is
like, hold on
like,
1 second. I'm just like,
I love
wow.
that you can at least talk on the phone because I can't manage it.
She
I'm
can't.
like, I gotta go.
She's like, I gotta go. I'm like,
oh, you
I
gotta
don't know
let
how you guys
live.
do it.
Just cover the phone and yell.
She does a good job. It's just so funny to me. And when she say, I'm so sorry, I'm like, I get it. I don't even know. Do you need to get off the phone? That's fine. But she's just like, no, I haven't spoken to you in a while. Just keep talking. And she's like, I'm like, hold on 1 second. You need to pick it up now. I'm like, oh my God. I feel bad. But Nneka, thank you so much for
Thank you
gracing us
all.
with your presence.
Yeah.
Definitely eye-opening, in terms of what we need to be attentive to, our bodies, our mental, our emotional, spiritual health in our 40s, because, it's definitely another ride, a consistent ride for sure, that we
Right.
don't get off until God says it's time to get off. So
Right.
at least with the things that we can do to at least manage and make the best of what we have, which, right now is what I want to focus on for the
Right.
rest of my 40s. With the help of God, of course, the spiritual
Absolutely.
healer, caller, I call on him. And I'm living through you guys until I get my man, until I get my
Amaka,
kids.
we're living through
Like,
you because you're
yeah.
amazing.
Uh-huh.
You're
Thank
amazing.
you. But thank you, Nneka, for being a part of this. We've been saying we wanted you
Oh.
on, so I'm glad you made time for this. How can people find you? I know you have a new business now. Do you want to talk about that real quick?
Oh my goodness. Oh yes. I don't know if the camera can see me.
Ah, yep.
Ooh.
I have
Yes,
on the
ma'am.
t-shirt.
Yes, ma'am.
Oh,
Yes, ma'am.
cool.
Yes.
Okay.
Mm-hmm.
Sorry.
No, no, no. Go ahead.
It's essential speech and ABA therapy. It is a franchise that has opened up in the Houston area. We also have a couple companies in Georgia, Virginia, and New Mexico. But essentially, I opened up the Richmond, Texas branch a couple of months ago. And what we do is we provide speech, ABA therapy, and occupational therapy under one roof for children on the autism spectrum.
Mm-hmm.
So, as you know, autism affects over 61 million individuals in the world. But presently, now in the US, 1 in 31 children have been affected by the age of 8 years of age. So, what we do is we provide services to kind of help address any challenging behaviors. And we focus on early intervention starting from 18 months to 6 years of age. So it's a much needed service, just trying to
Yeah.
help bridge the gap, especially in minority communities where it's being affected and maybe there's not as much resources. So we are open. It's a wonderful, passionate area of mine. And we just want to help and, be there as a support system to the families and also to the children that will be coming to receive our services.
Real quick question, like what should parents look out for that will determine they may need your services?
Sure, definitely. Developmental milestones are huge, right? So
Mm-hmm.
there's certain milestones you're looking for in children to meet. If you start seeing that they're not meeting them, then that's a red flag. For instance, simple milestones such as making eye contact or babbling or sitting up on their own or being able to walk are milestones that should be paid attention to. Is the child pointing yet? Is the child responding to their name? Is the child talking yet? So if you start seeing those things and they're not quite meeting their milestones, definitely recommend having your pediatrician evaluate them. And then they will now do their evaluation and recommend some therapies. Oftentimes they'll start off with speech therapy or occupational therapy. And then if we see that there's not that much of an improvement, then they may recommend a referral to a pediatric specialist, either a pediatric neurologist, a psychiatrist, a developmental pediatrician, or a pediatric clinical psychologist. And then they will be able to now do a further evaluation to rule in or rule out autism. And then based on that, if the child ends up receiving the autism diagnosis, then a series of therapies will be recommended. So one of the therapies that we have is ABA. It's called Applied Behavioral Analysis, and it's a therapy that kind of focuses on learning behaviors And based on the data they collect from kind of watching the child, they will now formulate a plan to help address those behaviors. So, for instance, if a child elopes, like once the doors open, the child like runs out and then they possibly run into the street and can get hit by a car. We don't want that to happen, right? So, what somebody would do in my clinic, the behavioral analyst in this case, she would formulate a plan to assess, okay, what are the triggers? Is it the opening of the door that alerts the child to just take off? You know, and then based on that, she'll formulate a plan. Okay, let's reassimilate this situation. Let's reassimilate opening up the doors. Let's see what's going to trigger the child to go, what's going to trigger the child to stay. And then from there, hopefully with time, the child will know that, okay, just because the door is open doesn't mean I have to jut outside. I can maybe go outside, but let me go outside and be aware of my surroundings.
Yeah.
So that's kind of what we do. And, there's talk of, ABA hasn't had the best rap when it first started off in the 70s. But it's definitely has evolved and it has improved. And the thing is, people want to take away is that these therapies are not to change the person's personality or who they are. It's only to help address any challenging behaviors like elopement. So that's kind of the purpose of it. Much needed. There's a lot of deserts, healthcare deserts that don't even have these type of resources. So I definitely want to be part of the bridging the gap and closing out the health disparities to help address this situation.
All right.
That's amazing.
That's amazing, Mama. Kudos to you. Congratulations
Thank
on
you.
this feat. And I'm sure you're obviously going to excel in this arena. Thank you so much for joining us. It was such a pleasure. And we'll definitely connect soon. And I'll be knocking on your door when I have some health questions to ask. So
Of course, anytime. And thank you all so much for having me. This was wonderful. Y'all are amazing. Keep doing what you're doing. And we're rooting for you on this end.
Thank you. Thank
Nice
you, Mama.
to meet you.
All right. Love to the family. Enjoy the rest of your day, okay?
You too. Thank you.
All right.
Bye.
Bye. Bye.
Final thoughts.
I love meeting someone else from your world. Nneka is so knowledgeable, clearly, and it's so great to hear about how much women's health is being looked at, because not only am I ignorant of my own health, but that, that menopause is becoming something that people are more aware of.
Yeah.
Because usually when a woman's having hormonal changes, people are just like, wow, she's acting crazy. No, she's
Crazy.
acting crazy. She's going through something that's very, very real,
Because like she was saying, like our parents just went through it, and they would be, they'll be told that they're crazy, they're stupid, they'll be looked down upon, they'll think she's cursed. That's all thing, like a cultural thing too, where they don't understand. So the fact that she's able to explain that makes me feel like, okay, there is nothing to be worried about. It's part of life.
And her dropping the reality on this is gonna happen, that's gonna happen.
When I saw your face, you were just like, oh my God. I was like, yep, it's hitting somebody. It hit her. Like, damn it. Now I have to pick up the phone and call my doctor. But I mean, she's just being real. She's one of those real people, like she's gonna tell you like it is. She would say it in a beautiful sisterly, motherly way. But she's going to tell you like it is, even if you don't want to hear it. So she's just more like, hey, this is the fact. Yeah. You better go take care of your stuff. Yeah. So thank you, Nneka, for gracing us with your presence. With you, I know that we are on the right track to making sure that we are healthy and happy in our 40s. And definitely paying attention to our mental, our spiritual, our physical body and all that stuff, because it ain't easy looking this good. I got a new health plan for the stress thing too. Yeah, it does help. It's the lyrics to No Scrubs. Basically, I feel like I'm gonna save myself a few years of life just for that. I know, right? So everyone, be sure to check out her new business. It's definitely something that you need to check out. I'm sorry. And be sure to leave a message, subscribe, tell us your thoughts, let us know what you think. In your 40s, what are you experiencing that you think people should be aware of? And until next time, thank you so much for joining us. We hope you enjoyed this as much as we did. Enjoy the rest of your day. Bye. Bye.
Thank you for joining us on this episode of Let's Talk, the AfroStyle Podcast with Nneka and Camellia. We hope you enjoyed it. If you missed this episode, you can catch up on YouTube and Spotify. And be sure to subscribe, comment, and email us at info@afrostylemag.com. We'd love to hear from you.